Welcome back to Winning Isn't Easy. What disability insurance carriers don't understand about neuropathic POTS, hyperadrenic POTS, hypovolemic POTS, and secondary POTS. Now, the disability carrier's ignorance seems to know no bounds when it comes to a POTS claim. The causes of POTS can vary from person to person, as well as the symptoms and the impact of those symptoms on your functionality. There are different characteristics of POTS that can occur in different types of POTS, and they're not necessarily mutually exclusive. POTS can be classified into 4 different categories, and I'm going to talk about each of those and how they present in terms of symptoms. And again, this is something that the disability carriers don't understand, and I'm trying to hammer in my POTS disability insurance claims. So let's first talk about neuropathic POTS. That's associated with damage to small fiber nerves, which regulate the constriction of blood vessels in the limbs and your abdomen. This, in turn, can cause symptoms and dysfunction in your limbs and in your gastrointestinal system. There's hyperadrenic POTS, and that's associated with elevated levels of stress hormones in your body. This, in turn, can cause significant tremors, cold or sweaty extremities, migraine headaches, and increased urination. The next type of POTS is hypovolemic POTS, and that's associated with an abnormally low level of blood. And this, in turn, can cause weakness and decreased tolerance for activities. Lastly, there is secondary POTS. Now, secondary POTS is associated with other conditions known as to cause automatic neuropathies. So we'll see POTS in diabetes cases, Lyme disease cases, autoimmune disorders such as lupus or Sjogren's. And I am now also seeing this in my long-haul COVID cases. What happens, of course, in a secondary POTS case is you have the symptoms of the underlying disease or medical condition, but that is complicated by the symptoms of POTS. It's crucial that your physician make a clear, definitive diagnosis of POTS, explain the type of POTS you have, and document your symptoms. This, in my view, requires teamwork. The disability insurance carrier is sending you activity of daily living forms and also sending they're also sending your doctor, attending physician statement forms, APS forms. Now, if you've ever closely looked at an APS form, you will see that they are not asking the right questions on purpose because the disability carrier doesn't really want the right information to make a decision about your case. So what I do, because I'm also a Social Security disability attorney, is I supplement that APS form with a residual functional capacity form that we use in Social Security POTS cases. Why? Because the Social Security Disability Residual Functional Capacity form asks the right questions in a POTS case. So I staple them together and I ask the doctor to complete them both. But we're not done yet. We've got to tie the diagnosis and the severity of your symptoms and your restrictions and limitations to your inability to perform either your own occupational duties or the material and substantial duties of any other occupation. And what I generally do is to have a vocational evaluator help us tie together this information. On the one hand, your doctor has confirmed the diagnosis of POTS or the underlying medical conditions, confirmed what your restrictions and limitations are, and now we have the burden to prove that those restrictions and limitations preclude you from doing your own occupation or the material and substantial duties of your occupation. Now, I work closely with my clients in developing their occupational descriptions because I want the carrier to completely understand what your duties are and make sure that that occupational definition is consistent with the definition of what's in your disability policy. So, for example, if you have migraines, you might have to go into a cool, dark room to deal with the migraines. Or if you're having urinary issues, you may have to spend a lot of time in the bathroom. Or you might have difficulty using your upper extremities because of the tremor issues. So we want to make sure that we are developing the symptoms, the functionality of your POTS syndrome and tying it together from a vocational standpoint. Now, you need to remember that the disability carrier might agree with the diagnosis of POTS, but they are always going to question the severity of your symptoms and whether or not those symptoms are disabling as that term is defined in your policy. So you've got the burden of proof, not the disability carrier. What I want to talk about next is tell you the story of Mrs. Outward. She was an electrical engineer with POTS, and it's a classic David versus Goliath story. That story will illustrate all the points that I have been making in this podcast. So let's take a break and come back.
Are you a professional with questions about your individual disability policy? You need the Disability Insurance Claim Survival Guide for Professionals. This book gives you a comprehensive understanding of your disability policy with tips and to-dos regarding your disability application that will assist you in submitting a winning disability application. This is one you won't want to miss. For the next 24 hours, we are giving away free copies of the Disability Insurance Claim Survival Guide for Professionals. Order yours today at disabilityclaimsforprofessionals.com.